5, 4.
Hi, good evening. It's Thursday, the 28th of January, and welcome to the Health Overview and Scrutiny Committee. So I'd like to welcome everybody that's joined us, and I'd like to ask if there's any apologies at this point.
Yes, Chair. Apologies from Councillor Tony Williams. Just note, if there's anyone who's watching the live stream currently who can't be heard by the meeting, they will need to leave that call and dial into the meeting using the phone number and code that we've been circulated, as you currently can't engage with the meeting. Thanks, Chair. Thanks
very much. And just like to ask if anybody's got any declarations of interest that they should declare them at this point. Okay. And if we review the minutes of the last meeting from the 5th of November, could I say if anyone has, if they're happy with those, and if there's any amendments to be made? Could somebody, one of the councillors that propose and potentially second them?
I think, is that, oh, there's Ian here as well. I'll propose it.
Thanks, Jean. And anyone like to second those?
Hey.
Okay.
Ian Marks will say. Sorry, apologies. Ian Marks will second.
Thank you very much, Ian. Thank you. So that brings us to the next item, which is the integrating care and the next steps in building strong and effective integrated care systems. And I think there's a report that's in our minutes there. And is that you, Simon Kenton? Are you there, Simon?
I don't think Simon's dialed in on the, I can't see his name in the list.
Okay.
Chair.
Adam.
Yes, Chair. Do you want me to, I'll go over my end and try and get hold of Simon, and then if you want to move on to the next item, and then okay, we'll try and get Simon on the call and go back to it.
That's great. Thanks very much, Adam. So the next one is a public health update on COVID-19, and that's the over to you, Tara.
Thank you, Councillor Warburton. Are we able to get my slides up, please? Thank you. Okay, so you've seen the format before. What I'm going to do is give you an overview of the COVID situation as it is currently. Please, I'll go through the slides, and if I could take any questions at the end, I'd be very grateful if you could just bear with me. Thank you. So next slide, please. Sorry, Amanda, I know that's grating for you. So we're going to, I'm just going to go through some of the surveillance trends that we're seeing currently. Before I even start, you will probably know that in Warrington, the rates of COVID are still extremely high. However, what I'm going to show you is an emerging better picture for Warrington. So please, if you can carry on with the slide set. Yeah, so Adam, the next one, please. Oh, there's some sort of stickiness on the slide set. Shall I just carry on, Adam?
Tara, I think the problem is that Adam's gone to get Simon Kenton, hasn't he?
Okay.
So I'll try to request control and see if I can move it on. Oh, it's done.
I've just requested, yeah, okay. So you will see that you know, it's still not a good picture for Warrington. We had almost 1,000 cases in the last 7 days. You know, we're always in a bit of a time lag in terms of our published data, but as you can see, the case rate is now at about 447 thereabouts. Now, when we were at the beginning of January, we were peaking at 880 per 100,000. So we've gone down significantly. That is a really, really good picture. We're still higher than the Northwest and England. However, we have come down considerably. So the case rate has decreased by at least 26%, if not more, because every day we're going down. If we're looking, however, at the 60 plus age group, and colleagues will know that that is the age group that are most affected by COVID and end up, sadly, a higher proportion in hospital and have severe complications. So our case rate is still high in that group. However, it is coming down and has decreased by over 40%. So that is good news. We're always concerned about how many of us are population test positive. Almost 50% of those going forward for a test are testing positive. So Adam, please, the next one. Oh, yeah, great. So you can see that it's the working age population that are still the most affected. So the highest case rate is in the 20 to 29-year-olds. That is significantly higher than our average, which is about 440. So it's quite a lot higher, and that's an area that we need to target, and hence we've got the lateral flow testing and those sorts of things in place. It's almost every time I do this presentation, the wards with the highest rate sort of changes. However, you can see that the wards with some of the highest rates at the moment are Culcheth, Glaisbury and Croft, and also Burtonwood and Winwick. You can see that with the Culcheth, Glaisbury and Croft, it captures the prison outbreak, which sadly has taken root. And also in some of the in Burtonwood and Winwick, it also reflects that the numbers of care homes with outbreaks at the moment. So that is an emerging picture. You know, the outbreaks that are happening sort of tend to boost up the numbers in certain wards. We've got the hospital on the line and they will talk about the pressures that they're under, but as you can see, there are still significant hospital pressures in the system. We think that the you know, nationally and locally, we may have hit the peak in terms of hospital admissions, but it's always very, very difficult to say whether that is actually the case or not. And sadly, we have had you know, deaths in Warrington, and we've had a total of 428 deaths to date. If you can continue, please. You can see that the black is not the good picture. So you can see that the age bands where they've got the highest number of blacks is in that 20 to 29-year-old age band. It's not in the 16 to 20-year-old age band. It's definitely in the 20 to 29 and in the 30 to 44 age group. So it's not a great picture for the working age population. You can see still that the 65 plus, there are still high rates there. You can see in the 0 to 15 as well that rates are still, they're not great, but they are much, much lower than all the other age groups. Please, the next one. Adam, is it all right to move on? Great. So I won't dwell on this, but you can see where we are compared to the England average and where we peaked. So you can see that we peaked in January. So that's everywhere peaked, but particularly Warrington. And we are coming down gradually. The next one, please. You can see that the difference in Pillar 1 and Pillar 2 testing. I won't dwell on that one, but you can see the amounts of testing that's been carried out in Warrington. And many more tests have been carried out in January than any other time, especially at the beginning. If you can carry on, please. Unfortunately, as I mentioned before, the hospital admissions are still high, but you can see that there is an ever so slight decline, but Lucy and colleagues will be able to clarify that a bit better. Thank you. Next one, please. You can see that the positivity trends across the timeline. You can see right from October, we were continuing to test people, and we're continuing to test people right through to current times. Thanks. The next one, please. If you look at where we are compared to all the Cheshire and Merseyside local authority regions, Warrington is third from the bottom, along with the other two Cheshires. Now, that's possibly reflective of the fact that we were in a higher tiered restriction over the Christmas period, whereas the Liverpool City region's colleagues will know were in a much lower tier. So many more of their restaurants and things were open, for example, whereas ours weren't. So that may explain why their rates are higher than ours currently, but they are still dropping across the piece. Knowsley is a bit of an outlier locally and nationally. It's still got very high rates. If you can continue, please. And the next one, please. Adam, is it okay to move on? Okay, it's a bit sticky, that one, isn't it? Shall I just revert to my presentation and then just run through the situation? Well, Amanda, could you just tell me if the slide set changes, please? Okay, I'm just going to rattle through the rest of the slides. What I'm going to present, which you can't see on the screen, oh no, you've got it on the screen, it's the education settings. So colleagues will know that we're particularly concerned about the early years settings and watching that space, because whilst primary schools and secondary schools have been closed during the lockdown, we know that our early years settings have not closed, and they are full. They're not just open for key workers, they are business as usual. And you can see the number of live cases, which is actually reasonably low compared to how many early years settings there are. However, there are a number of pupils that are self-isolating. And you can see the picture. Primary schools and secondary schools across Warrington, even though they are closed, they're open to key workers, and some of them have got high capacity, and they've got a lot of people, a lot of pupils actually going into school. So that's reflective of that picture. You can see that the numbers of staff that are currently isolating are 56, 326 pupils are currently self-isolating. One primary school and two nursery settings have actually closed because of COVID and haven't reopened since January. And that is a concern, because we've been working very closely with them. Paula and my team have been working very closely with the school and the settings to help them to open. You can see that the specialist provision have stayed open because they look after some of our most vulnerable pupils. And I think there's some good news that I heard that there's going to be the vaccine may be extended to that group. Okay, so the next one, you can see that in terms of the lateral flow testing, that's the testing for asymptomatic cases. We've actually got all of our schools and colleges with the ability to do that, and they have been doing that. There have been some changes in the advice nationally about what they should do around daily testing, so they're waiting further advice in that space. There's been a real push to have home testing for our primary school staff. Unfortunately, there has been a delay in that, but it hopefully will commence in February. So nursery staff have been using our mass testing sites. Thank you, Adam. Next one, please. Just moving swiftly on, in terms of, many of you will have gone to your local businesses and thought, oh goodness, they're quite busy, especially our supermarkets. We've worked very closely with our supermarkets in order to make sure that they are as COVID secure as possible. The slides have disappeared on have they disappeared for everyone on their screen? Okay, I'll go back to it. You can see that it's mainly our distribution centres and call centres and supermarkets that have some of the highest. It's not necessarily highest rates. It's where when you've got an app, the NHS COVID app, it pops up as a common exposure, and they also have had cases as well. Although they are COVID secure spaces to work in, they still have had cases. But there tend to be more clusters of cases or family connections of cases rather than transmission within that setting. So we have been working with, you can see the team has been working and successfully managed and closed over 180 outbreaks in those settings. We've been doing some targeted work with the taxi trade because of the higher occupational exposure in that group. And we've been doing spot checks with supermarkets and also online webinars with our supermarkets. And we've sent out a press release recently encouraging supermarkets who are doing the right thing to carry on. Kath's on the line. We've had a number of complex outbreaks in our care homes, but as a whole, we have got a very good infection prevention control team. So wherever there are outbreaks occurring, there is a support plan in place, and we have some very good care home providers who are doing the right thing and helping to manage the outbreaks. So they're using the risk assessment tool, and where possible, they are allowing care home visits. But that is obviously quite tricky when you've got an outbreak and you have to close. Thank you. Next one, please. Adam, is it all right to move on? It's always difficult when you're doing somebody else's slides, isn't it? Not moving. Okay, I'll go to mine. Okay, I've nearly finished, colleagues. So all I was going to say was, in terms of our testing, and I just wanted to pause here for a moment. We've got a good offer of testing locally. We've got the Academy Way offer. Some of you may have used that. That's if you're symptomatic, and that's 8 till 8, 7 days a week. We've also had since yesterday, we've had since earlier in this week, we've had a mobile testing unit that's fixed. So that's been happening on a regular basis, and we're looking to open up the government are looking to open up another testing site in Birchwood. You can see that from a symptomatic testing point of view, we've got quite a good offer. What I wanted to just raise awareness of is quite a lot of people, because the new strain of coronavirus are presenting with a range of symptoms that fall outside of the known symptoms of persistent coughing, loss of sense of taste and smell, etc. So what we're considering doing is opening up and saying to people who have got a range of wider symptoms, to actually go and access the symptomatic testing centres, because there is some capacity there. And what we're seeing is people who are not presenting with the usual symptoms ending up with a range of symptoms, when they're tested they are actually positive. So we're looking to signpost people to the testing facility in order to pick up people who may have different symptoms to the classic ones. So just wanted to warn you that will be coming into place quite soon. So in terms of the next one, please, Adam. I can see that you've just posted that you're struggling, but not to worry. Just wanted to touch on the lateral flow tests. Some of you will have actually accessed them yourself. We have set up two, well, one is a large scale testing site at Hallowell Jones Rugby Stadium, and one is a smaller facility at Grafton Hall Cricket Club. So one north of the Manchester Canal and one south of the Manchester Canal. They went live on the 11th of January, and we've done a number of tests in those facilities. And roughly speaking, we've picked up about 1.4% positivity. And if you think that in Warrington, there's probably about 1.5% community infection rates, we're seeing we're in line with that figure. So we think we're doing the right thing, and that, you know, it's for people who are key workers or people who cannot stay at home. Just wanted to pause there and just say, because of the unfortunate situation of the flooding in Warrington, we have actually opened it up to people who've been affected by the flooding so that they can use that lateral flow testing sites if they haven't got symptoms. Obviously, if they have got symptoms, they've got to go to the symptomatic testing site. So we've got the national rollout to schools of the lateral flow testing. The other thing that's new that was introduced a little bit too suddenly for most people was yesterday. You don't need a confirmatory PCR test if you have an asymptomatic positive test. So until yesterday, if you had a positive lateral flow test, you needed to then have a confirmatory PCR test. Essentially, because community transmission rates are so high, there is a strong indication that if you have a positive lateral flow test, it's more than likely that you've got COVID, so you don't need to go for any additional tests. So that was introduced yesterday. Okay, thank you. If you can continue, please. Just going to touch on the contact tracing side of the work. We've essentially got a lot of people who haven't been followed up by the NHS Test and Trace. They've tried, they pass it on to the local authority, and the local authority have followed up those cases. So I don't know if you can see the slide that I'm seeing, but about over 1,800 cases have been passed to the local authority from 21st of September to a few days ago, and we've been following those up, and we've been successful in following up about over 58% of cases. Now, you have to bear in mind that some of the cases that are referred to us directly are people who have said that they don't want to be contacted, or they're in hospital, or they're in sometimes they're actually incarcerated. So you know, the figure that we get sent includes everyone, not just the ones that you can actually reach. We've been doing some door knocking, which has been extremely helpful, because people who haven't wanted to respond to the phone calls have actually responded really well to the door knocking, and that's been going very well. So that's colleagues in the communities and neighbourhood teams that have been going out and making sure that people are okay if they haven't actually responded to any phone calls, to see if they're okay in terms of self-isolating or whether they need any support. So I'm just going to very swiftly move on to the vaccine. You will know all of this from the papers. The Pfizer vaccine and the AstraZeneca vaccine are currently being used. The Moderna has been approved. You will hear about the top 4 priority groups. Colleagues in the primary care networks and the hospital have been vaccinating furiously. So it's residents in care homes, the staff and people who are in the care homes. Priority number 1, those aged 80 years and above, those in 75 and above, and those are 70 and above and clinically extremely vulnerable. So there are lots and lots of sites available. There's the rugby stadium, the Hallowell Jones Stadium. There's also the Imran Pharmacy in Warrington. There's the hospital, and there's the Orford Jubilee Centre, to name just a few. There's also a drive-through facility. All of them are being well used. Apart from the hospital, the others are all on the national booking system, and they're also inviting local patients as well. So some of the pharmacies have just come on stream. They're going to be able to offer local appointments as well, which is great news. So there is a target to vaccinate the top 4 priority groups by the 15th of February. So just in conclusion, with the number of cases, we did have that reach of over 800 cases in the first week of January. We've come down substantially to about 440 per 100,000. That's a significant improvement. It's still worrying in terms of our 60+ age group. However, our business is doing a good job. We've been on top of the outbreaks. The local vaccination programme is well underway, and the majority of care home residents have been vaccinated, which is excellent news. There's been lots of really good learning and lots of really good practice. I just wanted to end on a slightly sad note about the recent floods. You know, many of those people are, you know, have been affected by the floods. You'll have seen the devastation that has caused. It's going to be a big adjustment for a lot of people in Warrington. We have worked in partnership with our blue light services, housing providers and the voluntary sector, and there's been a really good response of donations and offers of financial and other support that Care UK are coordinating on behalf of Warrington. So sad to end on such a sad note, but more work is going to be underway over the next few weeks that many of you will be involved in. So I'm going to pause there and just say thank you to my colleagues for helping to put the presentation together. Thank you.
Thank you very much, Laura. It was very comprehensive and very interesting. And I'd like to thank you and your colleagues for all the work that you're doing with COVID. And I know it's a very difficult time. Would any of our colleagues like to ask Laura any questions? No?
Stunned everyone to silence.
Yes,
Paul.
Paul.
Yes,
Hi, it's Councillor Wheeler. Sorry, I
sorry.
can't find my hand signal. Sorry.
Okay, go away. Okay.
Apologise. Thank you very much. I sort of caught most of that. I read in the newspaper at the weekend, and it's the first time I've seen it, that the hospital were actually offering had sort of a standby system for anybody that wanted the vaccine because they had some going spare. Is that true?
Do you want me to answer that, or do you want the hospital to answer that?
I don't mind. I mean, I agree with the sentiments of it. I just haven't read it apart from an article in the paper at the weekend.
Lucy,
Councillor Wheeler, it's a misnomer, and there has been a clear strategy that the hospital has employed to make the most of the vaccines, but I'll let Lucy answer.
Okay, thank you.
thank you.
Thank you both. So I think this is referencing something that we put in place in terms of being able to book in as many people in priorities 1 to 4 as we could, as quickly as possible. And one of the ways that we did that was to ask our staff to book in up to 2 each relatives or friends that live locally and who are in those 4 priority groups, which really helped us in terms of, so it would have taken 8 people full time to ring that same number of patients and book them in. So that's what the papers are referring to. Unfortunately, it's just been a bit misreported. So likewise, in terms of alongside our GP partners, we have only vaccinated people in those priority 1 to 4 groups. And I'm really proud to say that our wastage is less than 0.4%, and none of that is due to scheduling. So it's working, which is great, and we're strictly in line with kind of the national guidance and criteria.
Yeah. Oh, thank you. That's helpful. Thank you.
Thanks, Lucy.
Thanks.
Anyone else like to ask a
Yes,
question?
Chairman.
Okay, thanks, Ian.
Yes, we hear in the sort of the national press, and in fact, I think my GP confirmed the same to me, that vaccine is being diverted from the north to other parts of the country. Now, that may, I'm not saying that's not the wrong thing to do, but what are the implications of that for us? I mean, are we going to go a bit shorter than we would have done, or not? Are we still got enough?
I mean, other colleagues can comment, Councillor Marks, but I've seen no evidence that actually we're being deprived in our areas of those vaccines. There is a national shortage, and it can feel as though there is a shortage, but I don't think we are. We're seeing that the planned schedule of vaccines have come in. They are being used. Unfortunately, the demand outstrips the availability. But I haven't seen that evidence of vaccines being systematically diverted. But Andy may want to comment on that.
Thanks.
Okay.
Thanks, Tara. I can not add too much to that. I think the vaccine's being prioritised to make sure that people are progressing at the same rate. And we've actually delivered really well in the northwest. So there may have been some supply chain redeployment to help areas catch up if they were falling behind on that. But there isn't an intent to deflect to other areas for any other reason other than making sure we're being equitable with the delivery of vaccine, really. So it has caused some issues around sometimes the deliveries that have been communicated to the vaccine sites have perhaps been less than they were expecting. But usually if we put in a bit of challenge and say, look, we've got people booked, that's been amended. So it's all to do with the logistics, supply chains, and the way the computer pumps out the algorithms about where the vaccines need to go. And I suppose that as a scale thing, it's like a medium to large supermarket chain that's been set up in about 6 weeks. So it's there's going to be some glitches, but the protocols seem to be working quite well, and there's enough sensitivity to amend if we need.
Okay, thanks, Andy.
I also think it's remarkable the logistical operation that they've set up so quickly. Lucy, did you want to add another point?
Just a really minor one, which I think is a really positive that's happened this week, is that we now are able to transfer vaccine between sites, which was something that we weren't able to do previously. So that's really helping us in terms of dealing with any kind of local shortages. And we've been able to action that this week, so that's been good.
Is that because it's the AstraZeneca vaccine that's being used and it's far more tolerant to movement?
Partly that, and partly just because we previously didn't have permission kind of nationally or regionally to transfer vaccine in the same way that we do now. So a combination of those two things, yeah. Okay.
And does anyone like to ask any questions before we finish that?
Just on the inequalities angle for vaccinations and improving the uptake, Warrington was recently successful. Many of you will know Chris Skinkis in my team. He was successfully bid for £318,000 for Warrington to help improve vaccine uptake, particularly amongst people with disabilities and Black and minority ethnic communities, but not exclusively. Thank you.
Thank you. And just as I suppose it's a current event, there was an item this morning, I think, that came out of the BMJ regarding the information that was being given to people that had had the lateral flow tests, and whether or not they're being advised to continue the restrictions because even though they've had the test and it's proven negative, that they could still be infected. Is that the information that's being given to people in Warrington?
It is, yes. I mean, the difficulty is even if you have a negative lateral flow test, it doesn't really make any difference in terms of your need to socially distance Make sure you protect yourself and others using a face covering, etc. So it's absolutely not a green light, and that's a very difficult message to land. But I've seen evidence that people are acting very responsibly in Warrington. One of the difficulties about our rates is that a significant proportion of our working age population cannot work from home. They're people who work outside of the home, and that probably explains our higher rates of infection.
And in the 20 to 29 age group as well. Yeah. Okay, thank you very much once again, Thora. It's very useful, very informative, your presentation. So thanks for you and to you and your team. So we'll move on. I know that we missed out on the first item, which is about integrating care systems, but I'm also aware that Lucy's here, so it might be good if we moved over to Lucy, and once Lucy's finished, we'll come back to Simon about the integrated care. Is that okay with you, Lucy?
That's fine, thank you very much. It follows nicely on from Tara's, I think, in terms of the COVID position in the hospital. So I'll just give you the very latest information. So as of today, we've got 206 COVID positive patients in the hospital. That's actually quite a significant decrease since Tuesday. So Tuesday we had 232 COVID positive patients in the hospital. And I'm kind of optimistic, I guess, in relation to what Tara was saying, in terms of we're kind of seeing that slight steadying and a bit of a decline in terms of the community prevalence, which we often see reflected in the hospital kind of 10 days to 2 weeks later. However, kind of we have seen some drops like this previously and then them go back up again. So I think it's a very cautious optimism, shall we say. And so just to give kind of a comparison to, I guess, the current peak of wave 3, so the highest number of patients that we've seen who are COVID positive in the hospital during this peak was 243, and that was on the 19th of January. Just to kind of put that into perspective then, that quite significantly exceeded the peak in wave 1, where the peak of wave 1 was 124 inpatients on the 13th of April. So, not far off double, really. And then the peak in wave 2, which was 179 COVID positive patients on the 9th of November. We've expanded our critical care service even further. So we've now got 30 patients in critical care. Not all of those are COVID positive. And that's versus our usual critical care capacity, which is 18 beds. So a really significant increase in terms of critical care. That also doesn't take into account, we've got an additional 14 patients who are on CPAP, which is a form of non-invasive ventilation, and they're on our respiratory ward. So we've set up a special kind of CPAP area on our respiratory ward to kind of address that increased demand. And that's probably the key things that I wanted to say in terms of COVID. I've just a couple of other quick updates from a hospital perspective, and then really happy to take any questions. So a couple of positives. We have just made an executive team appointment to our Chief Operating Officer, who's Dan Moore. Many of you will know him already. Tara's given a really comprehensive update in terms of vaccines. The only thing that I just wanted to add on that is that we have now started vaccinating our inpatients, and we're one of the first trusts in Cheshire and Merseyside to do that. So at the moment we're only vaccinating inpatients who are in those priority groups 1 to 4, in line with the government directive. We also opened our what's called the Nest, which is our midwifery-led unit, on the 1st of December. So a bit of good news, and 4 hours after it opened, the first baby was born in the Nest. And then on the 13th of January, we opened our PACU, which stands for Post Anaesthetic Care Unit, on the Holton site. And what that enables us to do is to continue with more elective surgery, which is particularly important, I think, during the COVID pressures that we're seeing on the Warrington site. It means that we can transfer some of our patients over to Holton and still continue with some of that elective surgery, particularly for those patients who are higher risk, who typically we wouldn't previously have been able to provide that surgery for in Holton. So That's just another positive that I thought it was worth mentioning. I'm happy to take any questions on any of those.
Thank you very much, Lucy, and thanks to you and the team, especially the nursing staff and the medical staff, for the work that they're doing. And I think we were clapping for carers earlier on in the year, but I don't think anybody's reducing our admiration for the people that are doing the work. So thanks, and do pass on our best wishes. Does anyone like to ask a question to Lucy?
Hi, Paul. I've got one question.
Yeah. The hand system doesn't work, unfortunately.
It doesn't work, does it? No, I was.
Okay.
I just have to shout. Sorry, very rude. It's a question for Lucy. Have you noticed, Lucy, over the it's almost a year now, a change in sort of the demographic of the people you're caring for with COVID? You know, has age changed? Has sex changed? Comorbidities changed? Is there a pattern you can find yet?
So what I do know is at the start of this third peak, we were seeing an increased number of younger patients in terms of our inpatients with COVID, actually both in terms of our inpatients and presentations in the emergency department. But we do have a further breakdown, which I'm happy to send on if that's helpful, in terms of the age and demographics of the split in terms of our COVID positive patients. So I'm really happy to share that. I'll send it through to Adam if that's helpful.
Yeah, that'd be interesting. Thank you. Does it, can I just ask Lucy as well? Sorry, Paul. Does it break it down by area of Warrington? I'm just thinking about the health inequality aspect of this. Is it possible to draw anything out of that from the statistics or not?
I don't think that our data does, but I imagine that Tara's does more so, but that obviously won't relate specifically perhaps to the hospital admissions.
Yeah.
But I'll have a look and see if that's possible. But I know the data that we receive as a board doesn't do that in terms of the different areas of Warrington. Yeah.
Yeah. Okay. Thank you.
Thanks very much. Anyone else have any questions for Lucy? Could I ask a question then, Lucy? Have you discharged 26 patients since Tuesday? How have you managed that?
Oh, you mean in terms of the COVID positive decline? So 1 second, bear with me. I'm just going to pull up our live report. So
that's very positive news.
So some of it is positive. Unfortunately, it's not all positive. Because since Tuesday, 7 of those patients have actually died, right, and then the others are discharges. Right. So I'm sorry, sorry, that's not there.
Yeah, so the picture isn't quite as positive as it initially seemed. Obviously, there are still people dying of this condition. I think that also needs to be brought to the fore as well, doesn't it? So, okay, thank you very much.
Had our highest number of deaths in a week was this month as well in terms of COVID positive patients, but in terms of discharges, and Kath's obviously on, so we are working really closely you know, with our council colleagues in terms of facilitating those discharges. So thanks to Kath and team for all their hard work as well. And I think that's another real positive in terms of vaccinating inpatients, because we're really conscious that obviously care home patients have been vaccinated now. And what we wouldn't want to be in a position doing is to send someone back to a care home, and ideally we'd like to be able to vaccinate any inpatients that were going back to care homes before they return.
Yeah, I think you can see the whole system approach really, and how vitally important it is, and hopefully by the time of the next meeting things will be improving further. So thanks again to you, Lucy, and thanks again to all of the team, and pass on our best wishes. Thanks.
I will do. Thank you.
Thanks. Okay, so if we go back to the first item on integrating care, I understand that we're having great difficulties getting hold of Simon Kenton, who was originally going to speak to this. So I think Kath and Andy are going to speak to this. That would be great if you could.
Okay, shall I just start, Andy, and we can just do a bit of a double act?
Fire away, Kath.
Okay, so just to set the context of this, and Andy, please come in if you want to add some more. The paper that's attached, that's the NHS paper, is basically a consultation document which sets out proposals for the legislative reform around operational direction of travel. And it's asking some key questions about how integrated care systems can be embedded in legislation or guidance, and building on work that's been begun through the NHS long-term plan. So this document came out, I think it was December. It was either the first or the second week in December, with a deadline of replying in terms to 4 key questions that were posed by the 8th of Jan. So it was a quick turnaround, which was challenging, of course, because we were in the 3rd outbreak of COVID, plus the Christmas break as well. So the document that it sets out 2 options and asks for a response. There's 4 questions to respond to, and sets out 2 options. Before I go on, Andy, do you want to say anything else there?
I could probably add. I think this one was it wasn't particularly well heralded in the system, and it was picked up through the papers. Obviously, as Kath said, with the short turnaround, it does fundamentally change how commissioning arrangements work in the country. So it's quite an important thing to get our heads around locally. The ambition is to help promote the integration that we're well on with at place. So the things that we do around ICTB and working together. And obviously we've got a paper later about the integrated work we do on children's services, which I think is a really good example of what we can achieve when we do things together. And it helps to establish the footprints of place and integrated care systems, and along with that, integrated care providers for each borough. So that's the ambition of the document, and there were the 4 key questions at the end, which the subsequent paper captures some initial answers on. There is actually a more recent version of that which I have circulated now, but as a good start from Simon, this we can probably walk through this one.
Yeah, okay, so basically in terms of the options, there were 4 questions posed. The first one being, do you agree that giving ICSs, meaning integrated care systems, a statutory footing alongside other legislative proposals provides the right foundation for the NHS over the next decade? So Simon was pulling together the response for the council. I know, Andy, I think your response was as our lead for the place.
It was, yeah.
And I think we were agreed in terms of the response that it would be helpful to have a legislative footing. Again, you're closer to it. It's NHS in a way. Do you want to say anything more about the response to question 1?
Yeah, I think you've hit the nail on the head there. So the ICS as a more statutory footing, if we're doing things in that way, then it does make sense for there to be that statutory footing. Otherwise, there's a bit of a toothless entity that won't be able to progress things. There is a benefit sometimes in getting separation between some of the governance of the NHS from the delivery in place, because it means that the focus in each of the places can be strengthened and better deliver for the people and patients that we serve. So the other question was, in doing that, do we think that there'll be a greater incentive for collaboration? I think we've got a really good sort of sense of collaboration locally in what we do. So hopefully freeing some of the shackles of that with the proposed legislative reforms around the commissioning of services, not necessarily the governance arrangements, but the commissioning of service, should help with that. And then obviously the accountability to Parliament and patients. There are sort of pros and cons to moving that vehicle a bit further away, and I think we've expressed that in our response to say in some ways we can be more accountable to patients. However, there might be some issues with that flow through in terms of parliamentary and broader NHS requirements. So the ambition's absolutely right. there's some fancy footwork required on question 2, I think, for us to build our structures correctly locally. Don't know, do you want to pick up on question 3, Kath?
Yeah, well, I was just going to come in and say really that I think generally in both the responses there was a recognition that we really need to make sure that we keep things as local as possible, that the money as much as possible comes down to a local level, so that we can commission, we have the knowledge, we have the skills on a place-based setting so that we can do that. And that also to pick up that it was really important that the voice of children and young people wasn't very strong in the document, and that we needed to include the voice of citizens in the governance structures to make sure that that properly reflected the values and contributions of the various elements of the system.
Agreed.
I think the only thing that was in the council response that was added in was about proposing an option 3, because I think the biggest anxiety from a council perspective was about ensuring that local authorities were an equal party round the table, if you like, so that it's a really equal relationship between the NHS and local government. So in terms of the response that went from the council, it just added in. I don't know how much weight that will have, but it was something that had also been proposed by Northwest ADAS, which is the Association of Directors of Social Services, suggesting that there is a statutory joint committee acting as a strategic partnership body for the whole system, so that there's parity of esteem and representation between the local government and NHS, and that adult social care directors are included as mandatory members of the place integrated care partnership. So we'd included that on the end of the submission for the council because of the concerns about making sure that there is parity of esteem between health and local government.
And just to sort of back that up as well, as part of the Warrington Together response, because that was obviously important to council members, we put that in there as well in the final response. So the total response is additive, really, not reductive. And although it's an option that wasn't available in the original paper, it was important to a part of our place-based structure. So absolutely it needed to be in there. So we did put that forward as well to say, look, could this be given some consideration? And we can see that one of the benefits of asking for feedback, it does come.
It was also in there as well about reporting to the Health and Wellbeing Board, wasn't it?
It was. I mean, we've had the long debate, haven't we, about Health and Wellbeing Board is a good point of local accountability, and ultimately you can envisage that the Health and Wellbeing Board should be setting strategic priorities and helping us make investment decisions in the longer run. There might be some need to sort of freshen up how that works and freshen up some of our other structures locally to do that. But we're pretty much there, I think, with our ICTB and the way that works, and the good partnership work that goes on there through the Section 75 agreements. And those mechanisms can be expanded to be appropriately inclusive and also strengthen some of the Health and Wellbeing Board roles as well to make sure that we've got that definite place focus.
Okay. Anything further to add?
Nothing further, Chair.
Okay.
No, I think that's a summary from both of us. We're pretty, very much on the same page.
Yeah, thank you very much, and it's good to see that you're working together. That's continuing the together theme. Does anyone have any questions for Andy or for Kath?
Yes, Paul.
Okay, thanks, Ian. Go away.
Yes, it was, shall we say, an interesting consultation document, because there were two options there. But basically it said, well, there is option 1 if you want it, but really, we want you to go for option 2. So, yeah. You were being very strongly sort of led in a particular direction. I mean, I'm sure that probably is better than option 1, but I just thought that was a bit of an unusual way to do a consultation. And the other thing, I mean, I just wonder, do I understand it, Andy and Kath, that 2 reports have gone in from Warrington, one, if you like, let's call it the NHS one, and one the council one, for want of a better phrase. Now, this strikes me as a little unusual, and coupled with the fact that, I mean, I've only seen the one that's in the pack. I haven't seen your one, Andy. I mean, I hear what you say, but I don't quite know what's in it. I just wonder why we haven't got that in our pack as well.
I suppose, Councillor Marks, I wasn't aware that you hadn't had sight of it, so and wasn't asked to provide the paper as part of this section. But I have circulated it once I became aware that you hadn't seen it. So hopefully that will help. As I say, broadly, it is the same content really. The reason I think that there was a separate one is that was a specific request from Stephen Broomhead, that there was a separate section for the council response, and ultimately the CCG governing body did put some feedback through as well through the portal, but to the Health and Care Partnership we sent the Warrington Together response, which collated the individual organisational responses to say this is the sum total of our view. I think sometimes there is particularly with the NHS consultation, there's a different lens that local authority and council colleagues see things through, and it's absolutely right that that's reflected in a response, and sometimes that does need to be done slightly separately, and I think it's important that we acknowledge differences as well as similarities, because it's important that people do feel that there's a strength in having their group, and we don't fall into all trying to be the same thing. We've got the same purpose and a common effort and endeavour, but we perhaps bring different things to the table, and we shouldn't ever lose that, because I think that's been the strength of the way we've been working over the last 2 years or so, and particularly over the last 12 months, has been that celebration of those different skills, capabilities and viewpoints, and having a good way of bringing that together to make better decisions collectively. It's been really good.
So if I just come back in terms of the options then, because it seems to me that the NHS is saying option 2 and the council is saying option 3, which obviously are different options. So the recipients of this report, well, what will they think that people in Warrington are thinking?
I think it's right to raise option 3 and see if there is a chance to pause. Obviously, the National Commissioning Board will make the decision on the basis of the whole country and where things are. And I think there is a lot of support throughout the country for option 2, and certainly the revision of some of the legislative constraints that we operate under in the NHS as commissioners. It does signal big changes. So I think a lot of the things that are described in option 2 perhaps aren't precluded in option 3 in the paper, wouldn't be precluded down the line, even if option 2 were implemented. Because for me, when I read them, I thought they're kind of features of how you would make real that new integrated structure. So it may well be that option 2 is the preferred option to create the statutory vehicle, and the features should be aligned with that, or there'll be freedom and permission given to do that. And just as a useful footnote, the national team who put the paper together for the commissioning board, they had a webinar for CCG AOs, and they talked through the process of developing it, and they were seeking a permissive kind of solution to the issue. So I'm fairly comfortable that we can probably get the benefits of option 3, even if option 2 is the choice. If that makes sense. They're not contradictory.
Okay. Well, I take some comfort from that. Thank you, Andy.
But that, Andy, would that not be a regional decision rather than a local decision then? And would that not be taken away from us as a place? And it would that decision making would be moved more central or to the regional board.
So if it's done correctly, the governance should sit at that regional level, and the board have been fairly clear, and certainly the current ICS leadership or Health and Care Partnership leadership have been fairly clear that they want to empower place, and place is the priority, and they would like to see themselves as getting out of the way as much as possible, but also being compliant with whatever the reform is. But I think you're right in terms of there are risks that sometimes that can take the focus away from place if we don't pull hard enough and keep the focus here. So I think we've got to guard against that. But the things in there around strengthening health and wellbeing boards, better democratic input into decision making, and strengthening that, and we do already have democratic input at the ICTB, which is really good. I think we can deliver a lot of that through our place-based structure. And
the role of scrutiny, how do you think that the because you were talking before about accountability to residents and to patients, but and if that's the function of this committee, how do you see that would be continued if there is a regional decision making that now becomes almost arm's length to us? How do you see that continue?
That bit could get challenging. Obviously, for the local structures and the 80–90% of activities that occur, there wouldn't be much change from the way scrutiny works now. It would be, in fact, it would be easier to some extent because it would be an integrated commissioning decision-making body that would be there. So that would carry on. I think for those decisions which are taken at a region, there may well have to be sort of larger establishments of scrutiny committees, similar to when we've had regional decisions to make before, that there's been a committee of committees, if you like, for those things. But hopefully those are in the minority of decisions. But it is a challenge, and it's not fully fleshed out in the paper how that works, and that may become clear as the legislative documents go through.
I suppose that emphasises the importance of engaging with it and steering and making sure that our voices are heard in getting the right outcome for Warrington.
Very true, and I think there's an opportunity to get something in place that's highly functioning over the next 12 months or so, COVID willing, and that will put us in a good position for the ultimate switchover as proposed for April 2022.
Okay, thanks. Does anyone have any further questions for Kath or Andy? Not at all. Do you see any detriment to Warrington with this proposal, Andy, that you can be blunt with us about?
I like to think in terms of risk, Chair. So I think there are risks whenever you remove a locus of control from a local population. That distance can cause disconnect between local priorities and regional priorities. The commitments that have been made provide some assurances around subsidiarity. So we should be dealing with in Warrington what Warrington can deal with and escalating things that Warrington can't deal with. But there will be other pressures that come in through the assurance routes on that body, whatever it will be in future, that might potentially deflect activities. And so I think we'd have to see how that starts to shape up within the legislative framework and put safeguards in place to make sure that what's important locally stays important locally, because there are risks to that if we don't do it correctly.
Yeah, and I think one of the things that's happened over the last year, and this has been echoed in a number of the meetings and from a number of people, is that Warrington has really come together, and yes, you can see that with what's happening. And my concern, and I'm sure this is other members of the committee as well, are that a lot of that great work and benefit of combining services and getting almost seamless care from the, primary care into secondary care into social care, and those working together. There is now, having done that fantastic work to develop these relationships, there's now a risk to that being diluted and taken away from us. So I do believe that we've really got to make sure that this is the best for Warrington as it can be, and that decisions are taken locally rather than at a regional level that are going to be not in the best interest of Warrington.
I would agree, Chair, and I think the construct of the paper and the ambition is that is enabled by this and the changes, and I think in some quarters or quite a number, the current commissioning arrangements which fragment the approach have been viewed as inhibiting it. So We've done really well to work around that, I think, and get to where we are. And if we can leverage the benefits of the paper to try and get more of that quickly, then I think that's the risk is there that it doesn't go as well as planned. But that's for us, I think, collectively and through this committee for you to sort of make sure that we're going in the right direction, and us to be able to provide assurances between Kath, myself and other officers that we're on track with that ambition to really work in an integrated way. It's going to be challenging given everything that's going on, but I think if we embark with the right intent, we'll get there, and if we keep our eye on the right risks, we'll hopefully dodge those on the way.
It's quite an interesting time to make a major change of services and commissioning of services, and I suppose some people would say you never allow a crisis to go to waste, but to do it at this time when clinicians and managers and commissioners are all trying to sort out what is a massive national crisis, just seems a bit maybe unwise. And I understand that this is going to have legislation passed in order for it to happen, because it's going to repeal some of the elements of the Health and Social Care Act 2012. So is that likely to happen in the near future to enable this to progress?
My understanding is that it should happen over the first few months of this calendar year, and possibly February. And now I've checked on parliamentary papers, and I can't see anything that's been put forward, because obviously we're trying to keep abreast of, well, what's the shape of those changes to best position Warrington for the future. And as soon as there's any more word on that, I will let you know. But there haven't been any precise timescales, unfortunately. And I think, like anything, the ambition is to get this progressed for April 22. My worry is that might be quite a slow start, and it may all get a bit rushed. So as much as possible, we're cleaving to the word that localism is the important thing, and we should strengthen our integrated commissioning at place and provide an integrated provider system at place. And that's what we're cracking on and doing in the background as much as we can. But you're quite right, the constraints on us at the moment are fairly severe, and we've released staff from the CCG who are clinical to support clinical services and do other work that isn't part of the commissioning role. And we don't have that many. There's about 130 whole-time equivalents in the CCG, so we're not the biggest organisation to start with. So we've lost quite a bit of capability to support the system during the response to COVID.
Well, thanks again to you and Kath. But if there are any developments or documents that are coming through, I think myself and members of the committee would be really grateful if you could share them with Adam, and then Adam could distribute them to us, and then we're kept informed. We do get some information coming through, but if it came straight from yourselves, it would be really useful. So,
I'll ensure that, Chair. Thank you.
Thanks very much. Okay. So our next item on our agenda is the future of Warrington Hospital, and this is you again, Lucy. I should have asked you to continue after the last one. Okay.
No, that's fine. Thank you.
Thank you.
So I think Adam's got my slides. And apologies to those of you that were at the Health and Wellbeing Board, because there'll be a little bit of repetition for those of you that were there. I can't see any slides yet. I'm just seeing if Adam's. Are you okay, Adam? Ah, there we go. Thank you. So just a brief update really in terms of the plans for a new hospital in Warrington. Oh, they've gone again. I have them open on my own computer so I can make a start, and let me know when you can see them, if that's okay.
Yeah, you're there now.
You've got them. Fabulous. Okay, great. Next slide, please, Adam. Thank you. Okay, great. So I was just going to cover really briefly the bits that you'll be familiar with in terms of the vision around new hospitals and the context. Some of the progress to date, which I think is the really important bit in terms of the development of the strategic outline case and the shortlisted options, and then just a little bit about why it's really important that we continue to progress now, and some of those key next steps. Next slide, please, Adam. Thank you. We had a staff thing on live Teams for vaccines, and we had this exact same thing. So Adam, don't worry, you're not alone. Okay, so I think people are really familiar with the vision. What this slide does, though, is bring together the plans both in terms of Warrington and Halton, because they're complementary, and I think that's really important. So Warrington continuing to be the acute site, but also serving the fastest growing population in Cheshire and Merseyside, and then supported by Halton as an elective hub. And we're seeing that kind of work really well. Some of that's almost been accelerated because of COVID, as I mentioned previously, in terms of being able to support some further elective surgery at Halton. And it's not just really about a new hospital. Obviously, that's really important, and it's really important that our hospital services are provided in a fit for purpose estate. But I think the other important elements are around releasing land to support regeneration, and also ensuring that we're connected with education and employment, as well as health and social care, and maximising some of the opportunities that there are around shared estate as well across different sectors within the town. Next slide, please. Thank you. So just a little bit of kind of the local, regional and national context as it is now. COVID has actually highlighted some further challenges in terms of our estate, particularly in Warrington Hospital. So, for example, around the distancing between beds. So there isn't a 2-metre distancing between all of our beds. And in order to achieve that, we'd actually have to take out over 100 beds. So that's a really significant kind of additional challenge in terms of our estate. Obviously, there's been some other impacts, some other really significant impacts locally of COVID in terms of increasing in unemployment. We continue to have significant housing targets to meet in Warrington. I guess a positive is around our town deal programme, and I think it's really important that we align the new hospital development to that town deal programme, and specifically to the health and wellbeing hub that's identified within that town investment plan. And we've talked quite a bit today, haven't we, around the strengthened partnerships and increased integration. And I think I'd completely agree with the points earlier around, I think we're doing really, really well at that in Warrington. It's a real strength for us. And also that kind of continued drive to deliver more services in the community, closer to where people live and in more convenient locations, which I think has never been more important. You know, we don't want people to come to a hospital if they really don't need to. And also there's a benefit in that in terms of economic regeneration as well, if we're able to provide services in town centres, for example. And then obviously there's lots of changes and developments in terms of digital, and we've seen quite a bit of that also accelerate during COVID in terms of providing digital outpatients, for example. Regionally, the Cheshire and Merseyside Health and Care Partnership are in the process of finalising their latest version of the estate strategy. It's very important for us that a new hospital for Warrington is reflected in that, and it is indeed reflected in the current draft, which is good. And we've mentioned already kind of Halton acting as an elective hub during COVID recovery. And then nationally, well, we've literally just talked about this in terms of the importance of place-based collaboration going forwards, and I think everyone's familiar with the NHS long-term plan. I'll talk a little bit more about the health infrastructure plan in a little bit, but that's around the capital investment in new hospitals and the development of new health facilities. Next slide, please. Thanks, Adam. I think these are things that everyone is really familiar with. So there is a really compelling case for a new hospital in Warrington. I think the fact that we have the fastest growing population in Cheshire and Merseyside is really significant. We also have a significantly ageing population. We know that we have some health and wellbeing outcomes that are not where we would like them to be. So, for example, higher rates than the national average for alcohol-related conditions, falls and cancer outcomes. Parts of the Warrington Hospital itself are over 100 years old, and as I just mentioned, we're unable to meet social distancing requirements since the onset of COVID. And also a new hospital would help to release some land for housing and enable economic regeneration. And I probably don't even want to mention car parking, but we have 500 too few car parking spaces, which I'm sure you're also all very familiar with. From a finance perspective, we've recently done a value for money review on our original bid and strategic outline case for funding for both Warrington New Hospital and the redevelopment of the Holton site. And we've managed to improve that value for money ratio, or return on investment as some might know it, to over 100% when we combine the two, and to 90% for our new hospital in Warrington, which is really positive. Next slide, please, Adam. Thank you. I think most of you will have seen this before, but this just gives a sense of kind of all of the work that we've done to date, both in terms of the new Warrington Hospital plans and the Holton Hospital redevelopment plans. So I wasn't planning to go through this in detail. It kind of starts with when we submitted our first capital bid, which was back in 2018-19, but also references the fact that a new hospital, for example, is included in the Warrington local plan, and the significant amount of work that we've done since then in terms of the development of the strategic outline case. Next slide, please, Adam. The next slide, when it appears, is a similar picture, which just summarises some of the engagement work that we've done to date as well. So we've engaged over 130 different organisations in the development of the strategic outline cases for both of the new hospital developments, which I think is really significant. I think it's quite unusual to have done that level of engagement at strategic outline case stage, but something that we felt was really important. I guess going back to the beginning of the presentation, in terms of this isn't just about building a new hospital, this is about making sure that that links to all of the other services that we provide locally, and making the most, I guess, of that kind of integrated working in terms of service provision, not just in terms of services, but also things like employment for our population and education as well. Next slide, please. So this is the bit that's new, I think, since I last presented to the Scrutiny Committee, which is just a summary in terms of the strategic outline case. So the purpose of the strategic outline case really is to establish the case for change. So why do we need a new hospital? What will it look like? How much will it cost? What are the national drivers for that, which we've kind of just seen on some of those previous slides. And the purpose then of the approval of the strategic outline case is that it's recognised that it's compliant with the strategy and worthy of progress to the next stage. And there are a number of approval requirements for a strategic outline case, which are based on the Treasury's Green Book and NHS national policy. And in our case, that means that strategic outline case needs to be approved by the Hospital Trusts Board, and then also by our local CCG's governing body. So this slide just shows the shortlisted options that are identified in the strategic outline case specific to Warrington Hospital, and you can see the two preferred options that are recognised as the preferred options within that strategic outline case are to build a new hospital on a new site, or to build a new hospital on the existing Warrington site, and they're the two options that we're taking forward as part of the outline business case. Next slide, please, Adam. Okay, so this is just in terms of why it's really important that we continue to progress the cases now. And when I say continue to progress, what that really means is progressing with the development of the detailed outline business case. Now, just to give you a sense, the strategic outline case in itself is very detailed. It's over 100 pages long. So actually, the level of detail we're talking about in terms of outline business case is even more than that. The reason why it's so important, we're at a bit of a critical point in terms of new hospitals, and the main reason for that is around the health infrastructure plan, which you might have seen various stories about in the press over the last kind of 12 to 18 months. And so the government announced that there would be funding for 40 new hospitals. And those 40 hospitals have already been identified through the first phases of the health infrastructure plan, so HIP 1 and HIP 2 as they're referred to. And now there is an opportunity for an additional 8 new hospitals to be identified to receive funding. And we've been informed that there's a competitive process to identify those 8. So we very firmly stated our intention to take part in that competitive process, which we are informed is likely to take place in the spring. And in order to be best placed in that competitive process, we need to continue to further develop our cases. We do know that some of our competitors, for example, aren't even at the stage of having a draft strategic outline case, so we are already in a good position, but we'd just like to continue with that to put ourselves in the absolute best position in terms of that competition. Other kind of things that are important currently, so a decision on site will impact on the council's ability in terms of housing targets and kind of where developments will take place. So it's really important that sooner rather than later we're able to make a decision in terms of site, whether that be a new site or the current site. And as I mentioned earlier, kind of COVID and the infection prevention and control standards have kind of, I guess, exacerbated the need for new estate for the Warrington Hospital because of the inability to meet the distancing guidelines on bed spacing. And then I've already mentioned as well kind of the opportunity to kind of make some of the services at Halton more sustainable, I guess, to prevent against any further, well, the continuation of any COVID regulations or anything similar in the future. Next slide, please. Thank you. So just a quick summary of the key actions that we've completed following the previous update to this Warrington Health Scrutiny Committee. So the strategic outline case has been approved by the Hospital Trust Board and also by both Warrington and Halton CCGs and supported by the Health and Wellbeing Board. We mentioned in our previous update to Health Scrutiny that we'd have a resourcing plan for the outline business case and full business case, which we have done and drafted and has been shared at the Joint Strategic Oversight Group, which has been established. We have continued with engagement predominantly around stakeholders in terms of people who may be able to help us to secure funding as part of the next phase of HIP or through other routes. We also submitted a bid to One Public Estate to support both projects really in terms of Warrington and Halton. This is a really small bid, but what it will help us to do if successful is to explore potential sites for the Health and Wellbeing Hub as part of the Town Deal programme, which in turn supports the new hospital programme. And then so the Town Deal investment plan has been supported, which is brilliant because it links really closely, I think, to the new hospital and kind of allows us to think about what we might provide in that Health and Wellbeing Hub versus in the hospital. And as I mentioned before, we've completed a value for money review and increased the value for money and return on investment ratio as part of the strategic outline case, which will really be helpful in terms of a competitive bid process. And then I think the next one's my final slide. Thanks, Adam. Just in terms of next steps. So we're working really closely with our regulators, so NHSEI, in terms of their approval for the strategic outline case. Typically they won't do that until we have funding secured, so it's kind of partly reliant upon that competitive process as well in terms of being able to secure funding through the health infrastructure plan. But we are working very closely with NHSEI to make sure that every other box is ticked. And so we are continuing to develop the outline business case with support from the Strategic Oversight Group. So that Strategic Oversight Group has representation from all partners as well as local MPs. We await the outcome of our bid to One Public Estate, which we submitted in November, and we're due to hear this month or next month. One of our other key priorities at the moment is undertaking a site options appraisal for the new Warrington Hospital, and we're working really closely with the council on that and are commissioning a independent site evaluation currently. And yes, we continue to develop our case really in readiness for the opportunity to bid as part of that competitive process. I'm really happy to take any comments or questions.
Thank you very much. Does anyone have any questions for Lucy? Not at all. You don't get away that easy.
No, surprising. I should say thanks to Andy, who chairs our new strategic oversight group as well.
So the movement of the University of Chester from the Padgate campus through to the town centre, or the proposed move of that, is that likely to have an impact upon the bid and the plans? And what are your thoughts on that?
Yeah, so we have representation from the new University of Chester on our strategic oversight group, and are working really closely with them in terms of any opportunities that there are around shared estate. So, do you know if they are moving into the town centre, are there options for us to co-locate certain services? So for example, could we potentially co-locate the health and wellbeing hub in the town centre with some of Chester University's services as well? So I think there are definitely options, and that is something that we're working closely with the University of Chester on.
And does that sit in with your preferred option, which is option 1 of a new site? Would that be, would that fit in?
Yes, potentially. I guess we haven't really worked that up in detail yet. I think it could potentially work with option 1 or option 2. But yes, we've worked that up in detail in terms of the outline business case proposal.
And if we get the funding for further development, is that the next stage? And then at what point would it be confirmed that we would be one of the 8? How far away is that, or is that uncertain?
That's a really good question that I wish I knew the answer to. So it's a bit uncertain at this stage, but my understanding is that the way that the selection of that 8 works is that there would be potential to bid for the whole funding that we would need to build the new hospital, not just for funding in terms of developing the case further, which is good. But what I don't know is when we would expect to hear about whether our bid is successful or not, because I think the timescales even now are not confirmed in terms of when that competitive process will take place. I think it's probably because the people who would be running that process in NHSCI are, I imagine, slightly consumed with other things. But it does actually raises another important point, which is that the Cheshire Merseyside Health and Care Partnership are likely to be part of that process. So what we need to make sure, something that we're working really hard on at the moment, is making sure that the Health and Care Partnership are fully appraised of our plans and the importance of a new hospital for Warrington.
Okay, and is the funding certain? Because obviously there's been other strains on public resources and the national resources as well. And is there any doubt that these further 8 proposed hospitals are going to be built, or is it a definite?
As far as I'm aware, and I do frequently ask the same question, and the responses that I've had to date are that there is absolutely still a plan to invest in a further 8. I think there's a bit of a risk that some of the existing 40 that have been identified may not deliver because their plans are not well developed enough, or they have significant kind of blockers to some of those plans, which kind of, I guess, means that the 8 are more likely in a way. So that kind of supports the funding not being taken away from the 8, because if anything it might be reduced because some in the original 40 won't go ahead. But as it stands at the moment, every time I've asked the question, there is definitely going to be a competitive process for a further 8.
Yeah, I think you make a very good case of why Warrington, it's vitally important that we've got a new hospital. So thanks again. Thanks for your input, Lucy. It's been really helpful. Thank you.
Paul,
oh, sorry.
Yes. Lucy's, yeah, still there, Lucy, yes. No, that was very good. Thank you very much for that. I mean, we talk about 8. Have we any idea how many people might be in this competition? Is it sort of 18, 28, 38, 108? Have you any clues whatsoever? I'm not suggesting you know an exact figure, obviously. Any clues at all on this?
So I do know that in Cheshire and Merseyside alone, there are another 3 who all have very different cases. And I think that's part of the challenge in terms of the competitive process, because the criteria haven't really been agreed as yet. And that criteria will have a significant impact in terms of obviously how that process runs. So I don't know nationally. So whilst there are another 3 in Cheshire and Merseyside, also the previous 40 that have funding are skewed to the south of the country. So there's a bit of a case that the north and the northwest should get more funding this time than some other areas, but equally there's a lot of competition.
Okay, I'm sure there is. Thanks.
Thanks. Thanks again, Lucy. That's great. Thanks for your time this evening. I know you're very, very busy. So thanks again. Okay, so our next item is the Children and Young People's Emotional and Wellbeing, Mental Health and Wellbeing report. Steve, are you going to be talking to this?
Yes, thank you, Chair, if that's okay. Am I able to share my screen? Is that okay?
Yes, thanks very much.
No problem.
I think you might have to ask. Adam will help. Can you facilitate that, Adam? Brilliant.
So I think I can share my screen. If people could just confirm they can see my screen, that's really helpful.
We can see your cheeky smile.
Yep.
There it is. Yeah.
Your slides up now. Yes, thanks.
Right, that's great. Okay, so if everyone can see my screen, that's great. Okay, so my name is Steve Taylor. I'm the commissioning lead for maternity, children and families at the CCG. So I've been asked to come along to give an update on our children's mental health services and the work that we've been doing over the last 5 years. So I'm going to give you a quick canter through some summary slides which give an overview of our substantive local transformation plan that's been developed in conjunction with Warrington and Halton CCGs, but also as part of a whole system response in Warrington. So it's very much been developed with our children, young people, families and carers and parents, also our colleagues in public health and social care, and also our education colleagues as well. So it's truly a joint document. Now the full document's quite a substantive document because of the requirements around NHS England. So I've put together these summary slides to give you a kind of overview. Now, we would have normally had a plan signed off for 2021, but due to COVID and the suspension of the Health and Wellbeing Board that normally signs off this plan, we weren't able to get this signed off for last year, but we have continued to work on the plan and update the plan, and the 21-22 plan and an update on 2021 will be going to the Health and Wellbeing Board in February because it was suspended in January. So that enables us to have a kind of system sign off of the overall plan to make sure it's in line with our local needs and requirements and also meets the requirements of NHS England as well. So as I said, we're required to have this plan, and since 2015 and the launch of Future in Mind and the 5-year forward view for mental health, CCGs are required by NHS England to produce a plan with local partners every year and have that signed off. And we've done that, and we're coming to the end of the 5 years now, but it's our intention, depending on the structural arrangements that come through the ICS, and we've talked about that a lot today, is to maintain a local plan that reflects our local needs and our intentions and how we'll continue to improve services for children and people's emotional health and wellbeing. Over the last 2 years, as I said, it's been a joint plan with Halton and Warrington CCGs, and as we come to the end of the last 5 years, we've made significant progress in our services, and that reflects the continued investment, which is highlighted in greater detail in the fuller document. So we've had a strong governance system around this, which has really helped. So locally, it's well stitched into our Integrated Commissioning Transformation Board, so it has joint local authority and CCG oversight. It's linked into our SEM Partnership Board and our early help work, and we have a Children and People's Emotional Health and Wellbeing Board also. We've worked with wider stakeholders, including NHS England, our local schools, our therapy services, a whole range of local providers. And critical to the development of the plan and the ongoing work is the engagement and involvement of parent and carers. And we work with people like Warrington Parent Carers, or we listen, the the Youth Council, Youth Service Forums, Health Watch, and a range of partners to make sure it's truly reflective of local needs, and also to get some feedback around how we're doing. And we also link into the wider system and the Cheshire and Mersey Mental Health Programme Board. So we think that's really important, and it's helped develop the programme as we've gone along. Our whole programme was built around a nationally championed model, which was called the Thrive programme, which came out of the Anna Freud unit. We built this programme in conjunction with children and young people locally, and this is a reflection of some of the work that was done at the initial stages of our 5-year plan, where we try to move away from our kind of tiered model of access to mental health services into this new model, which was about thriving and doing well. And it was split up into 4 areas around getting advice, getting help, getting risk support, and getting more help to help young people thrive and do well and make a successful transition to adulthood. And we've done lots and lots around this work, and I'll cover some of that off, but we've spent a lot of time and effort and energy as a whole system making sure that young people have got access to good information and advice now through things like our online offer and Couth, and through our 0 to 19 services that are going into schools, our joint work with schools. The getting help elements around making sure that we've got things like our mental health and school teams well established, our school nurses, the Couth offer, advanced solutions, all of these wider services we commission. And then more intensive offers around things like crisis support at 24/7 for young people, our eating disorder services that we now commission across Mid-Mersey, and then the more intensive work that we're doing around some of our more vulnerable people in conjunction with social care and other colleagues, where we're looking at things like the No Wrong Door programme, where we've worked together to bid for national monies to support some of our most vulnerable and challenging young people. I'll come back to that in a little bit more. So in summary, our LTP continues to reflect the strength of our local partnership and how there continues to be a recognition of the importance of the 5 key themes from Future in mind around promotion and resilience and accessing effective support at the right time and in the right place, caring for some of our most vulnerable young people. We've been accountable and transparent through our work, and we've continued to develop the workforce and develop skills across the workforce to ensure that right across children's services that professionals are able to identify and respond effectively to children and young people who are in distress, and also know how to respond to those young people, but also where to get help and support if they need that from professional services, because we recognise that some young people sometimes won't always want to go to statutory services, so they'll work through other people. So we've enabled that through supervision and training and support, particularly around our education colleagues, but also around other wider health services. So what's been some of our progress to date? Well, we've seen a year-on-year increase in investment in services in line with the Mental Health Minimum Investment Standard, and the CCG continues to invest and increase their investment year on year. We're investing a further £372,000 as part of our Mid-Mersey investment in eating disorders services next year to meet the increased demand. We're going to be spending another £220,000 next year on neurodevelopmental services for young people to make sure that we can respond to young people with ADHD and ASD to meet demand. We'll have a continued focus on prevention and early support and intervention, and we'll be doing more joint commissioning with the schools across primary and secondary schools. I had confirmation yesterday that 61 out of our 70 primary schools will be joint commissioning with us to put mental health support, additional mental health support services into school until 2023, which is great news. We want to increase the number and the number of people coming into services, and one of the targets from NHS England was to increase the access target, so get nearer to that 10% of children that we think at any one point in time will have mental health issues should be accessing services, and the access and waiting times target was a key requirement for NHS England, and we've continued to deliver against that access and waiting time target in Warrington, and will continue to do so going forward. We've had easier access through self-referral and drop-in sessions in schools. Obviously, we've had a really extraordinary 12 months, and obviously some of the things that we would offer in schools have been intermittently offered. So we've been looking at how our mental health in school support teams, who were set up across 40 schools in Warrington as part of the first phase rollout, have now been offering their support services to all schools, primary, secondary and special schools in Warrington, to ensure that young people can get access to support and the staff that work with them. We're continuing to provide online support and crisis support for young people, and specialist CAM services, children's mental health, have gone to attend anywhere, and they're offering a range of online and offline support to young people, as well as face-to-face services are still possible to access. One of the unique things we've seen around the pandemic is a significant increase in the demand for children's eating disorder services, both in terms of the number of young people requiring support and the acuity. And so, as I said earlier, we've agreed across the 4 Mid-Mersey CCGs to significantly uplift the investment in the service to make sure we can meet the demand and meet the needs of young people early to prevent them becoming chronic and more difficult to manage. We continue to develop the workforce through our improved access to psychological therapies programme and through providing training and supervision. And as I said, we've met the requirements of NHS England in respect to quality and performance, and we have quarterly deep dives with NHS England as a system, and we've just had the most recent one and received assurances again. So what are our key priorities for 21 and 22? Well, we're nearing the end of 21, but for 21-22, we'll maintain our focus on early identification and prevention and intervention of emotional health and wellbeing issues. Oh, sorry, let's go back. And we'll work with our colleagues in Universal Services to ensure we do that. We'll have a greater focus on some of our most vulnerable young people, particularly those in the youth justice system and those on the edge of care. And I've mentioned the work that we're doing with Amanda Ainsbury and colleagues to make sure we provide wraparound support to those young people who are on the edge of care and custody, and some of our looked after children, and so we're jointly investing in some of the psychological services to support that as part of the No Wrong Door programme and some of the other great things that are going on in social care. We're also doing some joint work with the Youth Justice Service to look at a regional bid to draw down money to work with some of our most risky young people as well as a joint programme. One of the key elements of our work has been how we support young people who have special educational needs and disabilities, particularly those with neurodevelopmental issues, with things like ADHD and ASD, with autism and attention deficit hyperactivity disorder, to make sure that we can respond to those young people quickly and provide them and their families with the right support at the right time. One of the challenges has been about making sure that we can provide support prior to and following diagnosis if you do receive a diagnosis. So we've done a whole system piece of work to redesign our neurodevelopmental pathways with colleagues from early help in the local authority, our community services, our children's mental health services, and in conjunction with WARPAC, Warrington Parent and Carers, to redesign our neurodevelopmental pathway so it's grounded in early help now. So we will be fully launching that next year, but we've launched elements of that now, so children and people will access support through our early help offer within the local authority, and that'll provide a graduated response to need, and regardless of whether you receive a diagnosis, you will receive an access to an offer of support which should meet your needs. So that's really exciting. We'll continue to work on our crisis offer to make sure we can provide 24/7 offer to children, young people and families in crisis, and we'll also be developing our intensive home-based treatment model, which aims to keep young people out of inpatient care and Tier 4 CAMs, to try and manage and support them to remain in their homes and communities when they're in crisis. There's ongoing work around the Tier 4 model and looking at how we can again keep young people at home and in their communities, and only utilise our inpatient settings if we absolutely need to. And that work's ongoing with NHS England specialised commissioning to look at how we develop those offers locally. And as I've mentioned earlier, we're going to continue to increase the capacity in our eating disorder services. This just reflects the plan really, and I just wanted to flash this up as a final slide really to say that our plans for 21, although that they were challenged by COVID, we have managed to do a huge amount of work in Warrington over the period of COVID-19. We've chaired and led system-wide calls to ensure that schools and partners were well supported in terms of making sure that they're okay, but also in terms of making sure that we support young people through this time. So I just wanted to give you an idea of the work that we've done. And that's me, I'm done. So any questions?
Thanks very much, Steve. It's a very good presentation and a very comprehensive report in the agenda pack as well, so thanks for that. Does anybody have any questions for Steve?
I do, Chair.
Fire away. I don't know who you are, but fire away. I can't see any names.
Sarah, Councillor
Oh,
Hall.
thanks, Sarah. Yeah. Okay, on you go.
My connection, sorry. Yeah, it was a very, very interesting report, and obviously because of COVID at the moment, mental health, children and young people's mental health is a huge issue for a variety of reasons. You know, we're seeing depression, anxiety, loneliness, and it could be, you know, the next big crisis after COVID, with a number of children and young people needing that mental health support. So I guess it's a couple of points really. One, I just wondered whether there had been a decrease in referrals to services like HAMS during the pandemic. And then I wondered what kind of support, is there going to be more targeted support post-COVID for that, you know, potentially significant increase in people needing, or children and young people needing that support. And one last thing, just what support's been given to groups that are supporting families. So, you know, you mentioned the work with schools and early intervention, which is obviously very important, but there are groups that are supporting families as well. So I wondered what support was going to be given to them. Thank you.
Yeah, okay, so yes, we have seen a slight drop off in the demand for specialist services, and we've seen that reflected in the access target. It's not dramatic, but we have seen a slight drop off, and it does concern us. And we've had a number of conversations with our head teacher leads around how are we going to make sure that we are cited in terms of where young people are up to, how they're feeling, and how are we going to engage them. And one of the things that we've agreed to do in the next month is organise a conference with the heads to look at ways in which we can look to ensure that we're engaging young people as much as possible, because we realise that they're not in school at the moment, and that oversight we would have had of them and insight into what's going on in their lives is somewhat missing. So we're going to be doing some more work around that. Obviously, we're continuing to provide things like COOS, which is our online offer, which all young people can access. We're providing support to education colleagues, so where they are engaged with young people through classrooms or Zoom lessons, or if you're Chris Hunt at Cultured High School and phone your kids up and wish them all happy birthday and you pick up any issues, they know where they can get access and support around some of that stuff. In terms of supporting families, I guess one really good example is that we've commissioned an independent organisation called Advanced Solutions, who work with children, young people and families to provide support to children and young people with neurodevelopmental issues, because we know that particularly those families are finding these times particularly challenging, and they continue to provide call line support, online group sessions, family support, individual education sessions around supporting issues around managing children with young people with SEND. So they're continuing to provide and are very popular and well taken up by our local families. So that's some examples. What was your other question? Sorry.
No, it's just about I'll check my notes again. It's just about the kind of, is there a targeted plan to try and address what could be a significant uptake in demand on the services after the pandemic?
Yeah, I mean, we think we've got enough capacity in the system as it stands now. I guess if we saw it, I mean, we've seen significant surges in things like eating disorders, so we have invested further monies so what we're trying to do is keep very close to our colleagues in CAMHS services and community and schools to monitor the impact of the pandemic as we go. I think it's frontier adventure to some degree. It's unknown territory in terms of what the fallout and impact will be, and we've talked about things like bereavement and the impact of loss. We've not seen the general uplift in the terms of general mental health issues as things stand. Things like eating disorders, we've seen some unique kind of changes going on, but I guess we would continue with partners to kind of monitor this closely as we go, and if we see those increases in demand in services, then we'd look at how we would move resources around and or look at further investment to meet that demand as we go through our mental health investment standard.
If I just add to that, Steve, if that's okay, there's lots of work goes on across the school economy, as Steve knows. All the schools have mental health first aid training for that, and all the schools are trained in trauma-informed practices. It's quite a strong, universal practice system for responding to children's very early emerging emotional mental health needs in Warrington. It's probably the strongest practice system I've worked in for that. So I'm confident that needs get picked up. That's not to say that children don't have some very complex difficulties, but when they do, we've got targeted services that can pick them up and support them, and that are growing, as Steve's been through in his report tonight, and as we see the No Wrong Door come on board in April, ever growing and ever evolving in terms of our partnership working. Of course, from a social work perspective and an early help perspective, we've got systemic practice, which is about whole family working, seeing children as part of the wider system, and making sure that we identify that those needs as early as possible and respond to them in a relationship based way. So never say never, and obviously some children do have very difficult experiences, and COVID really hasn't helped a number of our children and our families in Warrington, but we do have the resources and the capacity and the expertise to respond to them, I think.
Thank you.
Anyone else have any questions for Steve?
Hi Paul, it's Judith. Thanks Steve, that was really interesting, thank you. Given that COVID is unprecedented and the effects sort of have evolved over the last year really, and nobody could have foreseen what was going to happen on all sectors of society, is there anything that stood out for you in terms of children and young people and the effects of the pandemic on them? Because obviously this is a learning curve, isn't it? It's new things, and you have to evolve your approach as time has gone on. Just wondering what's been most significant for you in terms of what you've picked up due to the COVID, not what you would pick up normally.
Yeah, I mean, I think the thing that's been most striking, I think there are two things. One listening to, I think some of our children and young people in our special schools and our families have really struggled because school is such a huge part of their life and their social network. And I think the impact of the flip-flopping in and out of school because of the requirements and the need to protect have had a big impact on some of those children who sometimes might struggle to understand what's going on, and the importance of those social relationships with the staff and those children have been a huge impact on them. And I think the impact on those families is massive, and I think they've felt it perhaps some of the most. Yeah. I think our young people generally are tremendously resilient, and I think most young people will probably be okay. I think my worry is that for those young people who are perhaps in vulnerable situations with with families who have issues, they're the ones that concern me, because schools are such an important place for keeping an eye on kids, and they're a sanctuary for some children, and if that's not part of their daily lives, then we need to think about how we're going to engage with those kids in the longer term. I think there is something unique about the pandemic and the effect on children's mindset who are prone to having eating issues. And we have seen a significant surge across the Mid-Mersey patch, both in terms of the numbers of children presenting, so there are new children, and the acuity in terms of the impact on their thinking that drives their behaviour that's made it more acute. So we've seen an increase in numbers of young people who've then been admitted to paediatric wards for refeeding, and whether that's about displacement of control, frustration, anxiety, those sorts of things, we've seen that play out within those services, which has been quite unique to the pandemic, and it started pretty much straight after lockdown, in the very first lockdown, and we've continued to see that play out. And as I said, so our response to that is to work with the provider and invest in the services to build their capacity around the evidence-based model of care that we have in place, and we hope that will meet that need. One of the conversations I've had with schools is about how to start a conversation with the schools more broadly about and young people and families about what's changed for you and how might we meet your needs more effectively in this very different environment. And I think we need to think as services about how we're going to engage with children, young people, families in this environment and climate now, because this could go on for somewhat longer, shall we say. We don't know, do we? So we really need to think about what the service offer might look like going forward and how it might need to change. And part of that is a discussion, I think, with the schools, because they're the people in daily contact with the children, and then with wider parents and carers, I think, as well. So we intend to do that, and we're just having to adjust our kind of model as we go along, really.
Can I come in, Chair? Is that okay?
Yeah, sure.
So just to pick up Councillor Wheeler on the comments about the most vulnerable, I can't speak, put my teeth in, the most vulnerable of children. There's been a lot of work go on between ourselves in the council and all of the schools. Children are being tracked on a daily and weekly basis. We're getting lists through of children who aren't attending school. If those children are known to social work or our early help services, they're being followed up. So children are either being seen at school because they should be in school, or being followed up by their social workers going out and visiting those children. It's been fascinating. I think one of the things that we said at the start of the pandemic that rings true with what Steve's just said is actually adults and health colleagues are absolutely in the firing line right now with COVID, but the impact for children's services is likely to be much longer term. And we'll be saying, do you remember COVID? Well, this is why we've got this cohort of children now, we've got these needs, as we really see what those are as time goes on, really. And some of that is time will repeat what I said before about, I do think we've got a strong practice system in Warrington that will help us to identify and pick up and target and support those children well, but time will tell across the wider country and locally as well what those needs would be. It's not all been bad, Councillor Wheeler, because actually I think we've done some work already looking at what have the positives been of COVID, what have we learned that we can take forward in our future ways of working with children and families. And actually never must we ever get away from going and seeing a child in their home situation, because anything could be going on at home and you need to see the family home, etc. But some of the digital communications that we've had with people, speaking to people over screens like this, speaking text messages to and from social workers to children, we've actually seen an increase in children being willing to tell us some things that are going on in their home environment because they've not felt as under pressure with a social worker sat next to them. I used to say when I was in residential childcare, you used to get more out of a child when you were driving them on a car journey to the shops because you weren't looking at them than when you were sat in front of them trying to do a piece of direct work. And we're finding that through, you know, the digital technology that kids have taught us about, not us teach them about, during COVID. So there'll be lots of changes and improvements in the way we work in the future that we'll take from this awful time that the country has been through.
Yeah, thank you. Thank you very much.
Anyone have any other questions?
Chair, can I come in there in relation to the community services in relation to the 0 to 19 offer? I think we've seen parents feel particularly isolated and vulnerable because I know during the first wave of the pandemic, a lot of their home visits and face-to-face contacts with services were stood down from that perspective, and we've learned a lot in terms of moving forward and the way in which we're handling services at this point in time and making sure that families have those face-to-face contacts, particularly new birth visits. And during that first 12 months, I think we can't underestimate the isolation that those families feel and the support that they need. And we've had some really positive feedback from families who've accessed the services and have used those services moving forward. We're just about to roll out our Chat Health, which is a text messaging service which will allow parents and children to get in touch with healthcare professionals via a text message, and so we're hoping that will support the delivery of our services as well.
Sorry, Chair, what Sarah's just said has just charmed me to just make you aware as well. We haven't seen this in Warrington, but nationally there's been a very definite picture of under 1-year-olds getting far more injuries in this during the pandemic, assaults from parents and carers, than what we have seen in normal times, and that has to be due to the pressures on families. We have had injuries to children in Warrington in that time, but we haven't seen an increase in that in Warrington to what we had before COVID.
Any more questions at all? Could I just ask a question on page 79 of the report about the data for self-harm admissions? It appears that the Warrington average is a little higher than nationally. Is there any explanation that you might have for that, Steve?
Yeah, I mean, most of our self-harm presentations, when you actually dig into the data, would not be a traditional. So what people understand by self-harm is sometimes things like superficial or deep cutting. And what we see in Warrington is our self-harm data is primarily made up of overdoses of things like paracetamol and anti-inflammatory drugs.
Right.
So we've been doing a lot of work with our colleagues in CAM services and around our early help and crisis offer to make sure that we respond to young people in a timely fashion. Some of the data that's used for that is a couple of years old now as well. So what we've been doing is refreshing and updating our data, and we did a updated report to our Intercommittee Commissioning Transformation Board recently to have a look at what's happening with that data. I think the other thing we need to be mindful of as well is sometimes the coding in A&E is not always the best, so often we're looking at the admission data as well, but we'd continue to monitor that over the through our mental health services dashboard, that's one of the data areas we look at as a kind of indicator of what's going on for our children and young people in terms of their mental health and how they're presenting. And it is our intention to try and get that down, but also in making sure that actually when young people present, that they're effectively managed and supported by services going forward so they can get the treatment they need and they can get timely access. So we continue to monitor that locally, and I'm happy to come back to future scrutiny meetings if you wanted to specifically look at, you know, hospital admissions around those particular issues, and whether that's become an increasing feature of the pandemic or whether that's dropped off. It would be interesting to look at some of that as we go forward in terms of some of the acute presentations for young people. I'm not picking up anything currently from our colleagues in acute paediatrics that there's been a drive or increase in demand around that, but we continue to monitor that data as we go forward.
Thanks. And just a general question, do you present this information in these presentations anywhere else other than to forums such as this or people that are already in the know?
Yeah, so I've recently presented quite a detailed report with Julia Carter from Public Health.
Yeah, but she's in the know, isn't she? What my point really is that what you're doing appears to me as somebody who doesn't know much about this, as an amazing piece of work and amazing service. And what Kath's saying and what Amanda's saying is that the services that you are providing largely are fantastic, but they're going unseen. And I think it's something that unless you're in contact with services, then very, very often you wouldn't actually know that this service exists. And I don't know whether or not there's some means of sharing your work and celebrating the work, and it's a difficult balancing act really, because you don't really want your work to be known that much of, because the nature of the work is that you don't really want to advertise it, I suppose. But what you're doing, appears to me, is a fantastic job, and I think if the people of Warrington could be reassured that looking at kids in school or kids in whatever area, preschool, that their well-being is being addressed in what appears to be a magnificent way. So all I can do is commend you and say you should be sharing this work outside to perhaps in another way into the residents of Warrington, to see that what Warrington is getting from the council, but also from your services, is pretty amazing, really, and particularly in the difficult times that we're having as well. So I mean, all I can do is commend you for it.
Thank you. We'll take that on board, I think, Chair, and I think we could certainly look to do some wider communications with our communications colleagues as to, the work that we're doing as a whole system, and we could do that in conjunction with our colleagues in the council and
I think some authorities, if you look, for instance, at Stockport, they have a banner of Stockport family, and people who live in Stockport know that the Stockport family is the group of multi-agency professionals who wrap round them, whatever their level of need and whatever their level of support is. I think that's probably a conversation that we need to have here in Warrington about what our banner would be and what that might look like for us moving forward.
Yeah, and then I know we see it from a councillor perspective and a committee perspective, but I think from a resident's perspective, if you're sat in listening to this and you hear about the healthcare from the hospital, from primary care, from the mental health services, and then you hear about the children's services like this, and collectively they're doing it. We're doing a fantastic job, but when a report like this comes to you and you see it, I just think it. Lots and lots of people, and I have to admit myself, I was reading stuff in here that I wasn't aware of the services existed, and I think there is an opportunity to share and celebrate your success, but also that's going to help with access to services as well. So thanks again, Sue, and thanks Amanda as well for all the work that you're doing. Thank you. Brilliant. Okay. Right. So we can move on. Thanks again, Steve. We can move on to the partner updates. So if we just go through these in order that we have them. So the Bridgewater update first. Is that you, Sarah?
Yes, it is. Yeah. So in terms of an update from community services, obviously we've seen our services come under considerable pressure from the third wave of the COVID pandemic. We've increased our scrutiny on our services to 5 times a week, so meeting on a daily basis and looking at our staffing and our pressures within those services, and trying to mitigate any risks and deliver as much of our offer as we can from that perspective. We've seen a considerable increase in our own staff sickness, particularly after the New Year period. Unfortunately, that's reduced in line with the community transmission rates, and we're seeing that falling at this point in time. We've been able to vaccinate the majority of our staff. We had a really good uptake from our vaccination site. We have seen some pressures around our adult services, and we've redeployed staff from some of our adult services into our services supporting hospital discharge, so our community nursing teams, to do that. We've had to step down a lot of our meetings internally and externally, really to release capacity, so that we're able to focus on the delivery of frontline services. I think we're in a really challenged position because we're still trying to deliver the restoration of clinical services where we can and address some of the waiting list pressures that we've got. But then whilst trying to deal with another wave, it's very difficult, and operationally we're having to balance that sensitively on a day-to-day basis. We have maintained all our frontline staff in our children's services, and I think that's really important, and to recognise all the pressures that those services are under, and so we can support children and families in the borough. We've had a lot of challenges as well from a service perspective in relation to patients cancelling appointments and not wanting to attend face-to-face appointments. So we've also looked at our offer in terms of our virtual offer or telephone appointments, and so we're just trying to manage that so that we can see as many patients as we can. But overall, I can say it's very difficult operationally to manage all those issues on a day-to-day basis with the challenges that we have.
Thank you. Any questions at all for Sarah? Anyone? Okay. So how's COVID impacting upon the district nursing services? Are they still going into homes, Sarah?
Yeah, we are doing continuing with all face-to-face visits from a district nursing perspective. I think what's really clear from the district nursing teams is the acuity of the patients that we're managing in their own homes. The health conditions are it's a lot harder to deal with. They're a lot more sick than they probably would be normally, so it's challenging, and it's challenging to manage those demands.
Okay. Thank you very much. That's great. Thanks.
Thank you.
Thank you. Do we have anyone from Health Watch Warrington?
Chair, we've had apologies from colleagues from Healthwatch Warrington and North West Boroughs, so I've just got a written update to circulate to members and colleagues outside of the meeting, and any questions can be raised directly with officers.
And I know that Tara dropped out earlier. Are you back with us, Tara, or is there anything from a public health perspective other than what you've added?
Chair, I don't think we have Tara on the call now.
And Simon's also left us, I think, as from a Warrington Borough Council perspective. Is there anybody else from Warrington Borough Council with anything further to add?
Kath and I are both here, not really got anything to add to the presentation that we just had from a health perspective from Steve. Really, we've obviously had an impact on our services similar to what Sarah was saying in terms of staff being off with COVID or self-isolating themselves, but the show keeps going, really, is what I'd say, Chair. We've seen increase in severity of need at the front door, but not necessarily an increase in open numbers of cases for children's social work and our early help services. And the vaccine is starting to roll out to children's social work and early help workers, social care workers as well, which we really appreciate the support of our hospital colleagues in prioritising them. That'd be it, really. We covered most things from Steve's report before for children.
Thanks very much, Amanda. That's very useful.
Paul, can I just ask? Well, it's a comment, really, and I suppose it is. Yep. I suppose it is to Kath and to Amanda. Really about sort of home care, domiciliary care, which seem to have, I think, forgotten. The forgotten heroes of this pandemic. Carers of any company have been going into homes throughout the pandemic. They face incredible risks, 4 calls a day to elderly people. There are so many risks involved, and I just don't think they've got the recognition that they deserve. They were not, as far as I'm aware, and I could be wrong on this, not in the front line of the queue for vaccinations when they should be. I just wondered if there's any comments on that. I mean, that might be, wrong, and I apologise, if Warrington is different than other places.
Could I come in there, Chair, please?
Yeah, sure. Thanks, Phil.
Hi, Councillor Wheeler. So just to firstly answer that question, I couldn't agree with you more in terms of the contribution of both the independent domiciliary care sector and our in-house intermediate tier reablement services, who have worked like Trojans. And in terms of the effort to ensure there is flow out of hospital, to prevent, to enable people who are really poorly, who need a bed to get it, they have worked tirelessly over Christmas and New Year, when everyone else was having a break, to deliver that care. So I would agree with you. In terms of recognition, we do our best at a local level to recognise that. We have weekly calls with all of our domiciliary care providers, and in fact we're just about to send out a letter to all frontline staff thanking them for their effort, encouraging them for the take-up of the vaccination, and explaining what they can do in terms of their behaviour post-vaccination to make sure that they stay well and the people around them stay well. And that's due to go out at the end of this week. What I'm happy to say is that generally, in terms of sickness levels, the domiciliary care sector has remained relatively stable, pretty stable, and we have very few packages of care waiting for discharge from hospital at the moment. So that's a really encouraging position. And we have also commissioned an additional 200 hours to try and support the effort, to keep the flow out of hospital. Just in terms of other general messages, very quickly, because I'm aware time is pressing. I think people are aware of the care home situation. We've got 13 closed and 8 on a watching brief, which means they've got 1 or 2 people who've tested positive. And we also have some care homes with very low occupancy as a result of the fact that we've had 12 months of people having contracting COVID, and our most vulnerable, sadly, passing away. So it's a worrying market situation that we are having to keep a close eye on in terms of long-term sustainability. We also, in terms of our day services, we've seen them open, close, according to the situation over the last 12 months. At the moment, they're closed. And we've also got some day services now closed as a result of outbreaks, which we haven't previously seen. All of this has a big impact on our carers, who are having to shoulder the burden when our services are forced to close because of the requirements around safe care. And what I would say on that is the Carers Partnership Board has been, I think I would say, reinvigorated, and we're in the process of, it's due for completion, actually a refresh of the carers strategy, because we recognise that this has just been extraordinary times and we need to really look at how we support our carers going forward. Respite capacity for carers has also been reduced because we have to make sure that we are adhering to infection control requirements with people coming in and out of care homes. So that's been a challenge. In terms of vaccination, what I would say is that our care home staff are in the first priority cohorts. All of our domiciliary care providers who've sent their lists of staff have been forwarded and are in the process or have been vaccinated, which is really encouraging. And we've had tremendous support from the hospital with staff, with getting staff, all of our frontline staff prioritised for vaccination. Generally, the other area of concern, just to report, is we've had a huge increase in referrals into adult social care, and particularly safeguarding, because if you think about it, it's nearly 12 months since we've been able to go and visit our providers, and we have had a couple of concerning safeguarding, organisational safeguarding investigations, which are complex and ongoing. And finally, just to say, you know, our biggest effort has been in trying to support the hospital currently, and moving staff over where appropriate to just try and ensure as much as possible that we can release that capacity for people who are really ill and need a hospital bed, but support them safely and in a timely way to either return home, which is always going to remain our first choice, or to a place of safety. That's probably it. A bit of a whistle stop.
Thank you.
Back there, Judith.
No, I mean, it was not a criticism of Warrington with the domiciliary care. I just wish nationally that there was, you know, greater recognition of carers and of domiciliary care. It seems to get forgotten. It's not sexy. It's, you know, it doesn't hit the headlines, and I think it is so desperately important. So, but thank you.
And perhaps one of the positives that comes out of COVID is that there's a reconsideration what is essential work and what are important workers. And I think the recognition of domiciliary workers and the people that were looked down upon previously need to be seen to be essential. And I think and appropriately paid as well. So anyway, thanks very much, Kath, and that's great. Warrington CCG, is that Andy? Is that you?
It is. Thank you, Chair. I'll canter through. There are four areas just to cover. One was COVID-19 and just a few supplementary bits of information. The flood, CCG changes, which is around the stuff that's going on with the ICS plan, and spinal surgery services, which we circulated outside the meeting. So the first bit around COVID-19, I think we've covered a lot of it in Tara's original update. It was just to say that the 15th of February target date for completing cohorts 1 to 4, which is everybody over the age of 70, including at-risk groups, so the clinically extremely vulnerable, and anybody who is paid to do care work as well is in that group, should be completed by the 15th of February. So, and we're on plan to do that with some mutual aid to just help where perhaps things were running a bit lower, but that should all be done, and that will have a huge boon in terms of reducing sickness and ill health from COVID. We've got flooding incident. We had a couple of healthcare facilities, Lee Court, which was an independent hospital, which was flooded quite severely, and we had to evacuate about 24 people from that site. I think there were 3 vacancies, so it'll be 21. We didn't commission all of those beds from Warrington. We commissioned about 11, but they've all been found safe alternative accommodation and had quite significant mental health issues that were quite long term, but so it was a hospital environment. We've done that. We also had a bit of an issue around Orford Jubilee, which is one of the vaccine centres. The waters were rising around there, and we had really good support from across the system, from partners, colleagues, to help people access the vaccine centre. We were worried the power might go out at one point, so we hastily wrote a movement protocol in the small hours of the evening and got NHS England cover just in case we needed to go and get wellies on. And some local companies as well provided taxis. I'm not engaged in promotion, but if anybody asks, I'll tell you. So the CCG changes, the paper that you've just had a look at went to the governing body only a week or so ago at the CCG, and obviously they've been asked for feedback that we submitted around the 8th of January. As part of that ambition to have the ICSs up and running in April, one of the things that wasn't specifically called out in the paper is that we're expected to have a single way of commissioning next year from sort of April 2021, and we've agreed to do that through a joint committee, which is basically a subcommittee of the governing body, and we have joint committees for all sorts of different reasons between CCGs, but this one will be specifically to address any Cheshire and Merseyside issues, and that'll fall under the scrutiny process here as a subcommittee of the governing body, but obviously shared with other CCGs, and those are looking at things that we already jointly commission anyway, but it's to provide that formal mechanism to make decisions. So that's still kind of at the early stages, and there'll be further discussion at the governing body on the 10th of February, so the papers will be circulated for that soon, and obviously they're available to you, and happy to take any informal comments, formal comments as we go through. So they'll be up and ready. Spinal surgery, obviously this has been going on for a number of years around how do we address people with need for fairly significant spinal surgeries. The agreement between the hospitals, Aintree, the Royal, Walton Centre and Warrington, who were the previous providers, was that we needed a single model really for Cheshire and Merseyside to do this well, and that's been agreed. There's been some local engagement and some regional engagement on this with patients and service users, which is, I think, reflected in the fuller paper for you.
Could I ask the question? What is it that you're, from a spinal services point of view, what is it that you're requesting of the committee? So I suppose it's just to note the recommendation that's been arrived at, that there's a single service, and that it has minimum impact on patients. So in terms of the changes, it doesn't represent a substantial variation in the way the service is currently delivered. And who makes that call on the substantial variation? You guys, I think. So we're recommending that it's not. So it's, if you believe it's a substantial variation, that's what we're asking today, or not. But in terms of, is a substantial variation, what are the actions thereafter? So with that's if there's a substantial variation to services, obviously, then we'd have to go through a slightly different process of engagement for it. And what we're saying here is that the things that would happen is if there's a change in site, the clinical delivery, other things, those are substantial variations. The plan that's in place doesn't really change those modes of delivery that are there. Okay, so can I just come back at you then with something? Yeah. The paper was circulated last week, so it was quite late in the day really, and it wasn't an original agenda item. So yeah, one of the first things that said what we were asked to consider was due to the minimal impact of the proposal on Warrington patients, it does not represent a substantial variation in the way that service is delivered, and the proposed development process, including the approach to patient engagement, is commensurate with the scale of the proposed change.
Yes,
so
that's right.
So there were two things. Is it a substantial variation? And the second part was whether or not the patient's engagement was adequate. And I've taken some advice or discussed with various people, and they've suggested that it is a substantial variation. And then the second thing, which as well as the fact that we've not had an opportunity as a committee to discuss it, was the engagement. And the engagement was based on a survey that was done on Merseyside in 2017, and as part of a larger orthopaedics and ENT survey. And the elements of that were engaged with Warrington patients was difficult to ascertain, but it looks to be minimal. And then also there's no engagement with Health Watch Warrington. So if you go back to the Health and Social Care Act and the NHS constitution, we've got to properly involve patients and public. And my take on this, having discussed it with a very small number of people and some members of the committee, is that the engagement with the public and the patients that this is going to affect in Warrington has not been adequate or commensurate with the scale of proposed change. So what I am suggesting we do is defer this until another meeting, and then we can have a full and a proper agended item, and then we can discuss it in its entirety. So
happy to do that, Chair. I think it's worth raising though, the service did change in 2017. So the arrangements that we're discussing don't involve any change to what's been delivered, and it has been through health and wellbeing boards and other sort of engagement mechanisms over that 3-year period. Happy to come back with more information on that, because we did try to get it on the agenda, but it wasn't able to accommodate it at the time.
Well,
we have
the report that was circulated to us very recently was dated last September 2020, yes. And the details of that, as I say, the engagement with the public of Warrington, I do not believe is adequate, and therefore we'll delay it and pop it on the agenda for the next time, and then it can be fully. And it may be that in the interim that there may be some more detail on that paper as regards the engagement with Warrington. If you're going to use the 2017 data, the Warrington patients that are spinal patients, and then in addition to that, the survey that was done with the 6 interviewed patients out of the Royal Liverpool, whether or not any of those were from Warrington and whether they were representative of the people of Warrington, because it clearly is not an adequate engagement with the people of Warrington from the information that has been given to the committee, quite late in the day. And I think it would be probably it would be better from a committee perspective if we were able to see some data from Warrington, and it may be that you would consider actually engaging with Warrington on a 2021 basis. So we can certainly bring that back, Chair. There are timescales that we're not the sole driver of, so we'll have to see. I'll get back to you with what the implications of that might be. NHSE have done a gateway assessment on this and didn't feel that it was a substantial change in terms of the duty to consult. We don't have that information. We've not seen any of that information at all. All we have got is the information that was shared with us as a non-agenda item that was an addition to the agenda, and I just feel that as a committee, if we're here to scrutinise the services that are being proposed or delivered for the people of Warrington, it is important that we are seeing information that is enabling us to make a decision. And at this moment in time, the information that we have before us is not adequate for us to fulfil the constitution of the NHS or our role as a scrutiny committee. So I completely accept that, Chair. It was submitted and I thought it had been accepted as a non-agenda item for review. If you don't believe there's sufficient information, absolutely, we'll bring sufficient information, and obviously the queries you've raised today will help to shape that. There is much more
obviously over the 3 years, that's been put together and presented at various other committees. So we'll pull that together and give you the opinion so that you're in the right place to make that decision. It was not the intent to try and push something through.
Yeah. I don't take it that it was at all. I think all we're doing is, if we're here to scrutinise the services of Warrington,
absolutely agree.
The example that came to me is, if I live in, let's say, Lymm, and previously I was having a spinal consultation in Warrington. As of 2018, that wasn't possible. So I had the option to go to Salford or to go to Liverpool. Because I live in Lymm, I will choose to go to Salford. I now have got that option if I live in the east of Warrington, to go to option. So I'm debilitated with a spinal condition. You know, I've got a disc that's just giving me real problems. The GP thinks I need a referral. If previously I have an option to go to Salford, I would take the Salford option because maybe my neighbour can take me to Salford. It's easier to do. Now I'm being asked to be taken to the Walton Centre in Liverpool, and therefore I do think that this is a substantial variation, and I think the people of Warrington need to be reasonably consulted with, and the point of the NHS. The Health and Social Care Act 2012 was there would be no decision about me without me, and all we're doing is protecting the people of Warrington to enable them to be involved in the decision that's being taken about them.
Agreed. I'm not certain that the perception that you wouldn't be able to go to Salford's correct from a commissioning perspective. I believe that Salford had refused to accept patients.
We don't have that information. In the information that's been given to us, there is no other explanation other than the decision has been made and you're going to Liverpool and you're going to be probably at the Walton Centre, and there's a possibility that outpatients may be at Warrington or Halton. There's no service that is going to be, in our eyes, an improvement or a continuation of the existing service. So my proposal is that you go away, you reconsider, come back with some further information that enables the committee to give full scrutiny to this, and then we can take it from there.
Already agreed, Chair. That will happen.
Okay, thanks very much for that.
Chair, if there's any issues with regards to timescales in coming back to the next meeting of the committee, we do have an option of holding a special meeting just to consider that one particular item, so that can be discussed outside of the meeting if that's required.
That's great. Thanks very much, Adam. Thanks. Does anyone have any questions for Andy at all? No, not at all. Okay, right. Do you want to come back at all with anything, Andy, or add anything further?
No, that was everything on my list to cover, Chair. So
okay,
happy that.
And as I said to the others, I think it's the work that the CCG and the PCNs and the staff within community care. I think their work is very much appreciated, and although more of it is probably seen now than usual, it is on behalf of the committee we're very grateful for the work that they continue to do. So thanks. Okay, which now also we've got Warrington Halton. I think we've already done the trust, so it just brings us to the work programme for the next meeting. I think we've got on the 25th of March, and we've got some things in there. Is there anything that needs to be added to the work programme? I suppose we could ask the question. Anything at all? So
I just wonder whether, apologies because I can't see the work programme because I don't have the full set of papers, but if it's not on there, I just wonder if it's worth adding town deal updates. I'm conscious that's something that's relatively new, that therefore might not be on the work programme already.
That would be very, very useful. And when would you like to do an update on the town deal?
Well, it should probably be Simon Kenton because he's now the lead for town deal. So if I have a conversation with Simon outside and come back to Adam, would that be okay?
That would be brilliant, and it would probably become a regular update as well, wouldn't it?
I think so, yeah.
That's great, and I think again it would be good for the proposals within that to be more widely debated in the public domain. So thanks very much for that, Lucy. That's great. Okay, well, thanks very much for everybody's attendance. I know that everyone is very busy and it's been quite a long meeting as well, particularly on top of a busy day. So a safe journey home, I think I have to say at this stage. So thanks for your attendance, and we'll see you next time, if not before. Thank you. Thanks. Bye-bye.
Thank you.